Well, I think we have a good crowd here this morning. I'm glad that you guys are all ready to go, and you guys are going to begin your Christmas vacation, if you will. And I hope your Christmas vacation will be restful, be safe, and get a lot of rest. Before we start, I'd like to offer a prayer. As for those people who are new, that this is kind of our tradition within the last few years that we bring people together. As we bring people together, it's bringing along the prayer, because this is basically some of the cultural things that we had from our ancestors. So I'd like to begin with that this morning, and then we'll go through the agenda, and we'll start in that. We'll start that way. Father, this day we pray that thy spirit will accompany us through this journey of meetings, and that thy spirit would be with us. We pray for thy spirit to guide, protect, and lead us, and to prompt us, that the agenda that has been set forth, that we'll follow that accordingly, and that will be pleasing to thee and pleasing to the coordinators, and that their input that they have, that it would be a benefit to our students, our Title VI programs, as well as our district organizations. We pray this day, Father, for thy guidance and direction that we ask. We pray that thy spirit will be blessed through this meeting, that we come together as a committee. We pray for our first responders, the health workers, case workers, nurses, and doctors that care for us. We also pray for a special blessing upon our families, that they may be safe, for their children that we are in care of during these hours. We bless also their teachers and those buildings that they belong to, that they care for our children, that they also be blessed with health and strength, and to continue their endeavors through helping our children throughout the year. And those people who serve our children, our students, those organizations out there that care for us, that we also ask for a special blessing be placed upon them. We pray for the East also, for the wisdom that you have granted us, as we put this wisdom into use and put into play, that will we continue guided, be directed, be prompted. As we go through the South Side, is the planning stages, the planning of our things to come, with our programs, with our families, with our loved ones, and with our children. And we go to the East. To the East is things that we offer for our families, the sacrifices that we put forth, and all those sacrifices that we offer for our families and for ourselves, and that at times that we give up ourselves. And we go through the North as the unknown. Those unknown things that we ask, Father, that we be prompted to react to that in a positive way. Shower us with thy gifts, and shower us with thy health and strength that we need, so we can carry on. That we hit a pandemic this year, and the COVID-19 has really taken a toll on many of us, our families, and those people that we know, that they would be comforted. And as they comfort themselves, that they will have the spirit of life given back to them. And these blessings, Father, we pray. And those blessings that we are also needful of this day, that we may be bestowed upon us and our families and our children and our students and our programs, and those people are close to us. This offering of prayer is small, and that we ask and we pray at this time. We do so in Jesus' name. Amen. Aho. Okay, is everybody still out there?
Barely.
Okay, we're going to go through the agenda this morning. I think I saw Melissa's name pop up. So what I'm going to do is we're going to go through the program first. We welcome. There's some introductions. First, the introductions for some of those people who are new. I think the Mr. Groves from Salt Lake, last time he introduced himself. And I think there's one piece there also is that if I get this right, where I just read something here with Lucy. You know, Lucy will be leaving the program through retirement, and you know, hopefully that she'll be able to say something at the end of our meeting to depart from us. You know, in spirit, but not physically, because we still need her around and stuff. And of course, we have Dustin, who's the other presenter today. And the last is Renee is going to be doing some electronic signatures updates and how to do that. And I know that everybody's all different in terms of their approaches in terms of getting electronic copies from your families. So with that, Melissa, are you on? Could you introduce yourself, and then we'll go from there. And
yes, good morning, Dr. Foster. Good morning, colleagues in Indian education. Very nice to be here. Thank you so much for the invitation. My name is Melissa Zito. I've been working in public health and Indian health, specifically for the Utah Department of Health, since 2004. I have the office recently, the Utah legislature provided appropriations for Indian health this last session. And even though we had COVID-19 budget amendments, if you will, for some programs and funding that had already been appropriated, Indian health was not one of the ones that was sacrificed. So we were able to maintain that funding. And with that, I've been able to hire an American Indian Alaska Native Health program coordinator and an Indian health epidemiologist, so we can move forward with the Indian health disparities that exist in the state of Utah and develop and improve partnerships with our tribal partners, tribal governments, and the Indian Health Services. So with that, I would like to take a moment to just let my two colleagues, Jeremy Taylor and Alex Merrill, just give a brief introduction. And I do have a PowerPoint presentation for you all, so I'm going to see how I can load it on this platform. I'm not familiar with this platform. So Jeremy, can you please take a moment to introduce yourself?
Hi, everyone. I'm Jeremy Taylor. I don't know if everyone can hear me. I was having some issues earlier with the unmute. So I'm with the Office of American Indian Alaska Native Health Affairs. I'm the health program coordinator. I was formerly the opioid programs coordinator for the office. I've been with the office for about 2 years, and it's just great to be here. Yeah, we're going to be presenting a little bit on the vaccine, a little bit on COVID, and a little bit informational regarding your programs. Thank you.
Hi, everyone. I'm Alex. I'm the new tribal epi for the Office of American Indian and Alaska Native Health Affairs. I work under Melissa, and I've been here for about a month, but it's been a very informative and very engaging month, I should say. I'm working closely with Jeremy on projects like the opioid epidemic and coronavirus right now, and I'm mostly just pulling data for presentations like this and stuff. So that's me.
well, welcome, all three of you. Welcome. We're looking forward to your presentation.
Thank you, Dr. Foster. I believe I have it figured out. So give me just one moment.
Okay.
And well, at least I thought I had it pulled up. Hang on just 1 second. I'm so sorry. I had it up and let's try it again. Okay.
The little arrow in the box is the share screen.
Can you see the slides?
Yes.
Okay, excellent. Thank you very much. So good morning. We did our introductions. I know that this is a training for you all. So we have an outline of what we would like to share with you. We want to identify what is public health and that role of public health in a pandemic. Talk a little bit about what COVID-19 is, some data that we have, what we know today, maybe as of yesterday, some prevention and mitigation strategies, what those look like, what those are, what you can do to stay healthy and share with families, vaccinations, of course, that's been in the news a lot lately, and then, of course, discussion and any questions that you all might have. So I'll just keep moving forward. So what is public health? Public health promotes and protects the health of people and communities where they live, where they learn, work, and play. That is a quote from the American Public Health Association. And it's very broad, but it means a great deal. Tribes also have a responsibility for the overall public health and well-being of tribal members, which has led to an increase in the types of public health activities occurring across Indian country. It's ultimately the work that's done to improve and maintain overall health and well-being within tribal communities as a whole. That is the public health statement from the National Indian Health Board. So as you can see, the community component of that, where people live, where people work, where people exist, go to school, wherever they are, public health's role is to make sure that that there is safety there and that people have the opportunity to be safe and do what they choose. The Department of Health is the state's public health authority, public health agency. Our mission and vision I've listed for you on the slide. Again, you can see how it correlates and how it blends well with both the National Indian Health Board and APHA definitions. We also recognize that as tribal governments are sovereign entities, they too, with the passage of the Indian Health Care Improvement Act and the finalization of that act actually in 2010, we acknowledge public health as a public health authority, tribal public health across the state of Utah, which has been extremely beneficial through the COVID-19 pandemic, which we can talk a little bit about. But we work hand in hand with our with the partners, tribal partners, the Urban Indian Organization and the Indian Health Services. We call that the Indian Health System because of all those moving pieces. It takes all of them to make that overall health system work appropriately, adequately, and efficiently. This slide I wanted to share with you as a visual, as it describes some of the areas that public health addresses. Most people see public health as, vaccinations. If you get, foodborne illness or you're sick to your stomach, or we have some kind of a food chain infection or bacteria and people get sick. Well, it's actually all of these things. And all of these things are housed at the Utah Department of Health as well. So we have mother to baby programs. We have food safety and healthy food initiatives. We look at mortality and morbidity and focusing on overall health, physical health for individuals. We have water quality. We have environmental quality, vehicle safety, seatbelts that we wear. Are a part of public health. Of course, tobacco, infectious diseases. We're looking at that right now with the pandemic, but we also, childhood immunizations and flu vaccinations are also a big part of the work we do. And then, of course, safe workplaces, making sure that when you go into an environment that not only as a customer, as a patron, that you're safe, but also as an employee, you are safe. So I just wanted to share that it sometimes is bigger than what we may have envisioned. Any questions up to this point? Okay. With the pandemic, the COVID-19, what is it? So this is just a very general term, and who is at most risk is also very broad. Coronaviruses are types of viruses or a germ that can cause cold-like symptoms and sometimes serious problems with lungs and breathing. COVID-19 is a novel or new coronavirus. As you can see with the picture of the virus, magnified probably 1 billion times. The little red things that are on there, I know you've seen pictures of this, kind of help it give it its name. It kind of looks like a crown, if you will, hence the name corona. So that's unique to these viruses. Who is most at risk for the virus? Anyone can get COVID-19. Those at risk of severe illnesses, of course, include elderlies that are 60 years and older, people with heart disease, lung disease, diabetes, any other chronic or immune system that's been compromised. So that's what we define and look at as COVID-19. This slide was prepared by Alex. So Alex, if you wouldn't mind taking a moment and just kind of going through this slide for folks, that would be great.
Absolutely, yeah. So this is the current state of COVID as of yesterday with regards to Utah and American Indian Alaska Natives specifically. And we can kind of see that it's disproportionately affecting American Indians and Alaska Natives. So the total cases, we've seen 3,444 among American Indian Alaska Natives with almost 50 deaths. But these rates down here are probably the most important. The case fatality rate is the number of deaths per case. So among American Indians and Alaska Natives, for every 70 cases, 1 person will die. And that's almost 3 times higher than what we're seeing across Utah and other populations, which is 1 death in 250 cases. So that's, when it comes to fatality, it's killing American Indians and Alaska Natives at a higher rate. Additionally, it's more American Indians and Alaska Natives are going to the hospital for coronavirus. For every 100 cases, 9 American Indians and Alaska Natives are going to the hospital compared to 4 in 100 throughout Utah. So that's where we're kind of seeing these disparities across racial and demographic lines. The positivity rate is how many tests are coming back positive. And as of yesterday, we're seeing kind of a positive thing for American Indians and Alaska Natives with a 19% positivity rate. So only 1 in 5 tests are coming back positive compared to 1 in 4 like we're seeing in Utah. So that shows that fewer American Indians and Alaska Natives are getting coronavirus now than they were previously. And then, so that's a positive trend, and we're looking forward to seeing where that trend goes. And then if you look at this graph at the bottom, it just kind of shows how many cases have been in Utah throughout the pandemic. All of the bars in orange show that the pandemic is increasing. There are more cases. When it's yellow, it means that it's staying about the same. And when it's blue, it means that there are declining cases. And you can see that right now at the very end, the last bar, we're in the blue, which means that cases are going down, which is hopeful. A lot of that has to do with mask wearing and staying home and socially distancing. So thank you for doing your part to decrease the spread. But again, it's pretty volatile, and we need you to keep doing these things so that we can continue to see this decline in cases.
Thank you, Alex. So what we can take from that information is, while positivity rates are going down, if American Indians do catch coronavirus, there's higher incidence for them to be hospitalized and to pass. So it's even more important in American Indian communities that we stress these strategies, which are prevention and mitigation strategies. So you hear this in the news, prevention, mitigation, what is the difference? We've just kind of tried to break some of these out for you so that in your mind, if you get questions or you hear things on the news, that there's a better understanding for you to translate for your families. So when we're looking at prevention, of course, we're the prevention of disease and health promotion rather than of diagnosis or treatment of a disease. So for example, with COVID-19, staying home if you're not feeling well, or if you have a slight fever, you're not sure, not going out unless you absolutely necessarily need to, making sure that you're sneezing into your elbow and not into your hands, not touching your face. People say, why don't we touch our faces? Well, if you've got bacteria and virus and who knows what else, our hands are just everywhere, right? And you're rubbing your eyes. That is a portal for virus to come into your system. So we want to make sure that you're not touching your face, so your eyes can also get in through your mouth. And then, of course, the coronavirus vaccine. We've all heard a lot about that. In the last few days. We have some information on that for you as well. So mitigation is an emergency management term, or a public health emergency management term as well. So those are measures that are taken to reduce the harmful effects of hazards and to manage those incidences that may have already occurred. So wearing a mask, making sure that you're washing your hands or sanitizing your hands frequently, social distancing. I'm not so sure that word, the social distancing piece, we can still be social and connected, but be at a distance. So I try to remind myself that it's more physical distancing. It's not necessarily social distancing, but because of the strategies, I need to put social distancing up there. I just wanted to make sure to share with you in my mind how I think about it. It's not that I'm socially distant from people, I'm physically distant from them. I can still interact and talk and laugh, even though I have a mask on. We can see a lot from expressions in people's eyes. So we still have that connection. Someone once told me that we might be physically separated, but we are community and culturally still connected. So those are some things that I keep in my mind. Of course, quarantine and isolation, those are great mitigation strategies. If you have been exposed to or have tested positive, those are two measures that we can take immediately to help mitigate the COVID-19. And then, of course, following tribal, state, and local guidance and ordinances. Many of the tribes across the state of Utah instituted stay-at-home and closing reservation boundaries and travel restrictions much more earlier on than the state overall. So that, I believe, really helped in the beginning. One of the bigger concerns for the tribal governments that they shared with us was their concern not so much about reservation, but those areas that are bordering and outside, close or near their boundaries. So that was a concern for them because their guidances were different. So that's just an example of mitigation, but following those local ordinances. We had a new public health order come out yesterday that will be effective through January 21st. And again, masks are going to be required throughout the state. So that's one of the most important and most effective strategies that we have to slow down the spread of the coronavirus. So I hope that was helpful for you all.
Hey, Melissa, I got a couple questions in terms of your quarantine and isolation.
Yes.
By the time, well, there's a time that you have contact with the pandemic or the COVID-19, the duration between that time and the end time, how long would that, you think that would be?
Are you speaking to like when you are exposed and
Yes,
then
when you're right,
if you become symptomatic?
right, yes.
They say that is between 7 and 10 days. Alex, is that correct? I know there was some guidance change on that a week or so ago, but my understanding is that we have the quarantine and isolation is 14 days. They moved that back to 10. I believe that's when they're seeing once you become symptomatic is within that time frame.
Okay.
Is that correct, Alex?
That's correct. And it can be as short as 7 days if you have a negative test for quarantine. So.
Okay. Now the other question is that if you have if you've been tested positive, where is it that where can we go? If like an example, say I tested positive, where can I go to try to overcome this? What is it? Where do I go besides, I mean, I know it's a hospital, but is there a procedure that you have to go through in terms of because you have COVID-19? Because I know that some of the families, some of the families, I'm pretty sure that they're hitting up against that wall. Like, they may have a relative that is sick, and they really don't know where to go and where to start and who to talk to and so on and so forth.
Well, first off, if they've been tested and they've been positive, they are in touch with workers, whether they're community workers or whether they're public health workers, to not only find out how they're doing, but to provide that type of guidance to them, but also to follow up with them and give them strategies that they need to monitor. So, for example, they would need to make sure they're monitoring their symptoms, make sure they're monitoring their temperatures. If they're getting worse, they would go call their provider, to kind of determine from there with their provider where they would need to go from there. There's no like one silver bullet for that. Did that answer your question a little bit or not? You don't tell people if you're positive with coronavirus, go here. It's actually, if you're positive with coronavirus, stay put and monitor your symptoms. Does that make sense?
Yes, that makes
and
sense.
If you're, yes. I know there's, and Jeremy, could you speak to the multi-generational family living and how that's managed with quarantine and isolation?
Yeah, I can. And with multi-generational, a lot of it depends on what jurisdiction you're in. So where you are basically in Utah, it varies from jurisdiction to jurisdiction if there's additional wraparound services they can provide. And typically that's provided either through the contact tracer or connection with a community health worker if you're off the reservation. On reservation, a lot of the tribes have services that they can provide. A lot of them have been doing care packages and things like that to get people to stay put, because the important thing is to stay put and not further spread the virus. But yeah, it really depends on what's available and what's. I know Salt Lake City does have some early on in the pandemic. I don't know how further they're being able to keep that service with the lack of with the run out of CARES funding. How much of that was funded by CARES? So it's going to be interesting to see in the coming year if there's still those services that are provided. But a lot of it is just stay put and try to isolate as best you can, even including wearing masks in the home and trying to isolate that person and get them to, if possible, have it as infrequent contact with others, members of the household as possible, whether that's the entire family masking up, using a personal set of utensils, toiletries and things of that nature.
Did that help, Dr. Foster?
Oh, yes. The last question is that the availability of shots for the community. Do you know when that might be? And
Yes, actually,
you know, I'm
oh, go ahead. We have some slides further down in the presentation on vaccination. Yeah.
Thank you.
Sure. Okay to move on? Any more questions, Dr. Foster, on this particular area?
No, I'm good right now. Anybody else have questions?
We'll just keep moving forward if not. Okay.
Thank you.
Uh-huh. So how can you stay healthy? I know that you all do a lot of outreach. You have a lot of contact with students and families. And there are things you can do if you're home to stay healthy. You can try to do. We all try to do them. Jeremy and I have been working 24/7. I kid you not, literally 24/7 since March 4th of 2020. And so we've tried to figure out how are we staying healthy? You know, how do we do that? Many people that are under stress, economic stress, kids being at home, learning from home, all of those interruptions in our patterns create stress. They just do. So what can we do? We can do our best to eat healthy foods and eat regularly when possible. Again, sleeping schedules those are hard to maintain just in normal times, let alone a time like this. But if you're thinking and have folks, you know, do their best to try to sleep as regularly or try to go to sleep as regularly as possible. Exercising at least 15 minutes a day, whether that's chasing your little ones around the house, whether it's outside playing with an animal in a yard, or taking an animal for a walk, or even just walking with your kids. I know the weather can sometimes inhibit that, but you know it's okay to be outside. It's okay to be active in your home as well. Of course, that balancing work, school, family, and home, we always have that. But again, if we keep those in the forefront of our minds, we can only do what we can do every day, every moment. But we do have choices, right, on how we make those decisions. So it's that mindfulness, keeping that present as much as possible is a benefit. Keeping to a routine. I find that again, it varies from day to day, but if you're aware of it, you will do your best to keep to that routine. And then staying connected with family, friends, even if it's virtually. I know we all have family that are in different parts, different corners of the region or the state, and thank goodness for phones that you can do the FaceTime or the Google Meets, and checking in. Also, if you've got families that have elderlies or relatives at home on a reservation, you know, check on them. You can see how things are going just by, you know, how people appear on the camera, and in background you can see what their living environment might be like. Are they keeping up, you know, with their dishes, or is their you know their laundry still you know folded over chairs, or if they look like they're not, you know, taking care of themselves. You can also see that. So that can also be helpful to reach out and get support for them. Of course, stress reduction, hobbies, activities that you love, and please also remember you can limit the frequency of listening to the news cycles on the TV and on social media and radio. Those can really, really increase stress levels. So it's okay to not always be informed every day, because odds are you'll get the information the next day. You know, or it's changed, then it will be completely different. So make sure you can monitor that. Jeremy, do you want to address this part? Take over here?
Yeah. And to add to that, it's important to note you can still even though you're staying at home, you can still go outside. But it's important to maintain that physical distance.
We're having a really hard time hearing
There's
you.
feedback there.
Hear me? Are you still there?
I'm still here. It sounded like there was some feedback coming from another line.
Okay, great.
Can everyone hear me now?
Yeah, it's probably good if everyone could put their computers on mute. I will try. Try it again, Jeremy.
Okay. But yeah, it's important to note that even though you are staying at home, it's important to note that it's really physical distance that you're working to maintain. So that still means you can still go outside masked up with a mask on, still engage in activities you enjoy, just maintaining that physical distance and trying to avoid small enclosed spaces within large groups. And then moving on, this is some of the outreach materials that the office was able to produce with the help of the Utah Indian Health Advisory Board. We have two sets of graphics here. One is for washing your hands and one is for sanitizing your hands. On some reservation communities, the access to water is very limited. And knowing that, we wanted to make sure that there's multiple ways to clean your hands in this COVID situation, whether if you don't have readily access to running water. Hand sanitizer works very well, but we wanted to make sure we had that continuity of having both in place when we pushed out messaging. Melissa, if you go to the next one. And then here's another one for face mask, just kind of showing in a visual image that physical barrier. So the barrier kind of prevents that expulsion of air. And so that's the way the mask protects you. We expute a lot of air and particulate when we breathe or when we talk. And so that's the importance of the mask, is to prevent the spread of that particulate, which may carry virus if you are infected. And then we just did one with a type of mask that are available. There's multiple versions with all. The N95 is typically used in hospital situations, post-COVID essential worker situations, but there are other masks that are readily available to the public, with a homemade cloth, those blue surgical masks that you see so frequently. And then if you look at the materials, we wanted to keep the continuity between the materials, kind of keeping that same color and theme so they're easily recognizable. Melissa, if you want to do the next one. And then here's just another one talking about how it's important to keep your hands clean, face mask, social distancing, because that high risk population is there. It's very important to protect the high risk population, which is the elderly and those with comorbidities. So this is kind of that messaging along the same lines in terms of implementing those mitigation and prevention to protect the most vulnerable in our communities. Next one, Melissa. And then this one is for the flu vaccine. So the flu vaccine, it is flu season, so we still wanted to promote good public health in terms of getting your yearly annual flu shot. So again, along the same theme, I think once we get more general distribution of the COVID vaccine, we may do a similar flyer to the code for a COVID specific vaccine, kind of informational and keeping in line with what we've been doing in terms of pushing as much information as possible to tribal health providers and tribal public authorities across the state. Next one, please. And then this is kind of the process in which we develop these materials. So our office operates utilizing state consultation with tribal consultation between the state and tribal governments. It's kind of this back and forth feedback loop where we either engage the Utah Indian Health Advisory Board, our tribal leaders directly, and typically developing materials. It also is a lot of the way we do a lot of the work at the office. But mainly, this is just to show how we've kind of operated in terms of development of these materials and much of the policy we've developed in COVID. Next one, Leslie.
So there, Dr. Foster, there was a question about vaccines and COVID vaccine. Yes, they have arrived. Yes, they're in Utah. Are they available for the public yet? Not quite. So here is a timeline, if you will, for the distribution of vaccine. And this may be something very helpful for your coordinators to also have on hand. And we can send any of these flyers, materials to you all so that you can print them and hand them out to families, excuse me, or if you need to post them in places, you're more than welcome to do that by any means. So as you can see, mid-December, healthcare personnel who are in high-risk environments from hospitals in the state and that provide care to the highest number of COVID-19 patients. So the state of Utah pushed the vaccine that has come the last few days out directly to the hospital system so that every hospital has vaccine to vaccinate their doctors, nurses, respiratory therapists, their environmental workers, whomever is in that direct bubble, contact bubble, if you will. And then, of course, now we're entering into late December and January, and there are vaccines also that will be pushed out to those agencies that have healthcare workers that are remaining in hospitals that are still high risk. The healthcare personnel in clinics now, pharmacy staff, tribal health, long-term care, assisted living, skilled nursing, and other personnel who are at high risk. School staff are also in this timeline. And then EMS and first responders, public health workers, tribal EMS and tribal public health are also included in this deployment. I do want to point out, however, that, well, I'll finish through the timeline. So February and March, again, continuing with long-term care residents and essential workers. And then March and July, they're anticipating the general community for all Utahns. And that includes reservation communities. So I hope that kind of answers the question. As some of you might have, or you do have relatives that are living on reservations or even accessing services here in Salt Lake City through the Urban Indian Center or through Sacred Circle Healthcare or the Skull Valley Band of Ghost Shoot Healthcare System. Those facilities, tribal governments, and the Urban Indian Organization had an option for vaccine distribution. They had, they could work with and receive distribution through their states, or they could work with and receive distribution through the Indian Health Services. Most of the tribes in the Urban Indian Organization in the state of Utah have gone with the Indian Health Services. So the state doesn't really have a lot of involvement in terms of quantity or time frame of when those vaccines are coming. So I just want to make that clear because you might get different or questions. How come we're getting the vaccine but people at home are not? There could be a little bit of a difference or a couple of weeks of a lag, if you will, in that distribution. So I just wanted to let you all know that and share that with you. It's not intentional, it's just the choices that tribal governments made. This is a slide to kind of share with you about the two vaccines that are, well, one is been approved through emergency use authorization through the Federal Drug Administration. Last week was Pfizer. Moderna is the second company that is producing vaccine, and they had received yesterday. The advisory board for immunization did approve the information that they debated and discussed and learned from, and moved that into the FDA's wheelhouse to approve. So hopefully we'll hear something today, if not already. Well, I don't think it's already, but that the Moderna vaccine will be ready to go. Once that emergency use authorization has been passed, Moderna is also ready to push out or ship their vaccine out across the country. So here on each one of these is some information about what we know from, I don't want to say the literature, because I haven't been able to read all of the literature, but what we're being reported to from the FDA in the research that's been presented to them. This is what we can expect in terms of side effects from receiving the vaccine. And as you can see, they're not much different than the flu vaccine that we already get on a yearly basis. So it's promising. It's promising. So in the meantime, I guess I should back up. Do you have any more questions about the vaccine, Dr. Foster?
Yeah, I got another question in terms of if a person already had COVID-19, has been exposed, now has regained their health, now they're back into almost normal. Do they need to be injected with the vaccine after they still they need to do it?
That's a really good question. It depends on when their exposure was. So I believe, and Jeremy and Alex, correct me if this is wrong or if it's changed, but my understanding is that if they've had coronavirus within 90 days, like if vaccine was available to them tomorrow, and they had just recovered from COVID 2 weeks ago, they wouldn't need to get the vaccine. So there's a 90-day period that they wouldn't need to get the vaccine. Did I say that correctly, gentlemen?
That was my understanding as well.
Did that answer your question, Dr. Foster?
Yes, it did.
Okay, great.
Thank you.
Mm-hmm. Any other questions about vaccine? Okay, so in the meantime, I know we have this COVID-19 fatigue. People are becoming very weary and just wanting and waiting for things to get back to normal, whatever that might be for them. But we need to be vigilant. We need to be strong advocates for continuing those prevention and mitigation steps that we mentioned earlier. Wearing a mask is the most effective way. And remember, if you have cloth masks, remember to wash those frequently. If you have masks that have filters in them, remember to change those filters and wash that mask frequently. That physical distance, you can still go on a walk with your walking partners or friends, as long as you're, staying a safe distance. If you're in the grocery store in line, make sure you have that physical distance. You can still talk, but just maintain that distance. Keeping your hands clean or sanitized, making sure you're not touching your face, making sure you're still coughing and sneezing into your elbow. If you do blow your nose in tissues, discard them in a trash receptacle immediately. Wash your hands, don't touch your face or other items. If you're not feeling well, please stay at home. Call your provider, or if you're alone, call family members. Let them know that you're not feeling well and you're home. If you have an opportunity to get a flu shot, right now we're in flu season. And being sensitive to the flu, makes you extra sensitive to the coronavirus. So those complications, we want to minimize those, right? So getting a flu shot is something really important that you can have your families or yourselves do. And then again, following tribal, state, and local stay-at-home and public health ordinances, making sure that you're aware of those. And I don't know if you've had an opportunity to visit the coronavirus website, but there's a lot of information on there. There's also information related specifically to schools and education. So that might be something that would be helpful for you to just kind of look at, kind of go through in your vast personal spare time, right? I'm sorry. You may not have that spare time, but again, that's an option for you to arm yourself with more knowledge and information so that you can pass that along. Here's contact information. If you need or have questions, or families have needs or questions, please know that Jeremy and I and Alex are here for you, and let us know how we can help. Sometimes you might not be sure. That's okay. Reach out to us, give us a call. Sometimes families might be living off the reservation, but they want that connection home to health possibly. Let us know. We've been able to get resources and support to individuals that are not living near their reservation or their health system, but the tribes are committed. They want to know how their members that are living off the reservation are doing and if they need anything. So we have a bit of a process at the Department of Health between our office and the contact tracing teams that are spread out throughout the state. If we do know that there's an American Indian family or individual that's been exposed and needs support, we've been able to make those connections and kind of facilitate that. So please don't hesitate to reach out and let us know, or if you have any additional questions or concerns. And right now, that's it for us. Please stay safe, stay healthy, stay informed.
Hey, thanks, Melissa, and your group. Are there any questions out there? A lot of good information. Melissa, I just have one little small question.
Sure.
In reference to counseling. I know that a lot of my acquaintances, some of them, I know that there's a couple of people that I know that they've gone through this COVID and they're recovering and they recovered. And the piece that they had that we're struggling with was how to cope, the coping mechanism. And they really didn't know which way to turn. And basically it was just sharing and, we text back and forth and, there's really nothing I could offer other than just the support. Is there like your office, does that carry like with a person may be struggling with it and they need somebody to talk to? Would your office be available for that type of communication?
We're not behavioral health or counselors, but we could maybe facilitate getting in touch with something like that. There's also here, the Urban Indian Center of Salt Lake, they have telehealth and telebehavioral health. So that's been very effective. If people have phones, they've been able to provide support, counseling on that telehealth piece. And also many of the tribes also are instituting telehealth, telebehavioral health, specifically for that very reason, Dr. Foster. So there are some options for folks. Just let us know and we can help facilitate that.
Okay. Okay, well, thank you again. It's very, very informative and a lot of good information. So again, thank you for the services that you're providing and the information that you've given us. And I'm pretty sure that a lot of the Title VI folks are, internalizing this. Now, the next on the agenda is Dustin. I don't know if he's on right now. Dustin, are you on? He was having some difficulties, so we might have to wait for him just a little bit.
Dr. Foster, this is Melissa. May I ask one last question?
Oh, sure.
You and your coordinators. Would you like us to send you the materials that we have electronically so that you can disperse them to the Indian education coordinators?
Yes, please.
Okay.
Yeah, you could either send it to Renee
Okay.
or myself, one of the two.
Okay.
And we'll surely get it out to everybody.
Okay, wonderful. Thank you.
Thanks. Okay, is Dustin on? He's not on. I guess our meeting is going to be short then.
He's on, but we can't hear him.
Oh. Okay. Is there anything that we could do to help him out? Let me text him real quick here. Okay. Dustin just joined us again. Hey, Dustin. Conversation-wise. Huh. Well, okay, according to Dustin, he says that he'll try again to get back on. So let's give him a few more minutes and
Why don't I just show them how to do an electric signature real quick?
okay, let's do that. Let's jump to one. We'll put Dustin to a side until he gets his difficulties corrected. Our next presenter is Renee, and she'll basically give you some ideas on the electronic copy. So let me just turn the time over to her, and we'll go from there.
Can Melissa unshare her screen?
Can you guys hear me?
Yes.
You can hear. This is Dusty. You can hear me?
Okay.
Yes.
Okay. I'm all right.
You're
I
back?
had to download a couple things again.
Okay. We're gonna jump over you, but now since you're back on, we'll get you back on the schedule, so you
All
can
right,
meet your 11. You can meet your, was it 11 o'clock one? Do you have a? Yeah. Okay. I
All right,
appreciate that, Dustin. Hey, thank you again for bringing us some good information as a professional development presenter. And I'll just I'll turn the time over to you.
Thank you. So I was part of something, and let me see. Can you guys see my beginning of something?
Yes.
Yes.
So, do you see like a thing that says Utah Racism Compact?
Yeah.
All right, cool. All right, I'll keep going then. So, I don't know if you all saw this, but on Monday, I think it was Monday, maybe it was Tuesday, I can't remember. The state of Utah introduced a compact for this that really addresses racism really hard. And they've been trying to find something that would put state government, state businesses, individuals within the state on notice that racism is not good and it's a bad thing. So they got a committee together and typed something up, and what they typed up was the following. And I'd like to share that with you. They sent it to me to review, and my first impressions were, this language is really strong. It's and I was wondering how anybody how everybody in the state legislature or in state government would accept it. So I was invited to this meeting to meet with the governor, and they, and before we got there, they were like, okay, guys, we gotta sell this. This says what it says, and we might get some kickback either from him or from his team, that might be nervous about it. And my big thing was, if he accepted this compact, I thought our duty to the governor was to let him know that people would hold him to it. That we're in an age now where people can find information and people can trace down what you've said and what promises you've made, and this is something that he's going to have to take very seriously. Especially right now in December, when next month Lieutenant Governor Cox will become the new governor, and so we wanted to make sure Lieutenant Governor was on board with this. And so I'm gonna share this with you, what it says. Hey Chuck, could you go on mute?
I am on mute.
Oh, is that me?
For those people out there, is there a possibility that you could put your microphone on mute? That along with your telephone?
Let me see. Thanks, Chuck. And so the way this starts off, and I'm just going to read it, and you can just talk to me about what you think about it. It says, "We, the signers of the Utah Compact of Racial Equity, Diversity, and Inclusion, affirm that all people are created equal under God. A racially equitable state requires us to act and create a society where race and ethnicity do not determine value, opportunity, and life outcomes. We also affirm two key principles on which everyone can agree: that all Americans must have a truly equal opportunity to prosper, and that economic inclusion is essential to creating these opportunities." And so that language seems pretty straightforward right here. It's nothing that any of us haven't heard before. And so I was like, okay, this is just one of those compacts, right? This is just one of those things we sign. It's just there's some fluffy language, and we can all say, yeah, yay, no racism. We can all say that together. But then I got to the next part. And this next paragraph really hit me hard. And this was the paragraph I thought was going to be the hard sell to the state of Utah. And it says, "We view racism as more than an individual character flaw." Right? A lot of people say, well, yeah, there's probably racist people out there, and it's probably not a good thing. But our government, our system, our laws, there's nothing racist about that, right? And we can't let a few bad apples spoil this whole system of belief that and idealism that we work under in America. Those are just a couple bad people. But this paragraph, look at it. It's more than just an individual character flaw. It is a system of ideas, beliefs, practices, structures, and policies that give some people greater opportunity to be fully human and live a happier and healthier life than others. Unraveling centuries of racism requires anti-racist actions and policies right now. That paragraph just hit me super hard on that, because this is an admission that maybe we don't what we operate under, maybe what we see, maybe the legislation we pass, maybe the way we enforce laws, maybe, and I'm not just talking about police brutality, or but we're looking at other things. We're looking at every aspect of government and social structure. This is an admission that there can be racism there, and when we shared that with the governor, he was like, "Yeah, we got to fix that," which was really nice to hear, and he was like, there's too much of this going on. There's too much of people setting things up to where it only benefits a specific group of people and leaving others out. We need to begin to change the way our structure is so that everyone can participate and receive the benefits of these things. And so it was really nice to hear. And when Governor said that, he also said that this is my last year. I'm leaving next month, right? But this is something that I hope I can stay involved in. I hope that the Multicultural Task Force will keep me here to speak on this issue and champion this issue for them. And when he said that, Lieutenant Governor was like, I'm 100% behind this. We need to fix the systems in place that will allow people, that will allow everyone to succeed. And the last sentence in that paragraph, unraveling centuries of racism requires anti-racist actions and policies right now. So it's more than just saying, hey, it'd be nice to have more diversity. Hey, we shouldn't say this about this person because the color of his skin or her skin. It needs proactive action. And as we read more in this compact, you're going to see what that action may look like. It says, we pledge to advance behavior on a personal, business, and government level that will establish priorities and laws that create inclusion and equality of opportunity for all. We likewise pledge to foster inclusion in every aspect of our organizations and society while addressing social injustice and inequality and condemning all forms of prejudice, bigotry, and discrimination. We believe that the solutions to many of our nation's ills are straightforward and include equal access to education, employment, housing, and healthcare. That, just since I started in this position in February, and when the schools went online, this pandemic really pointed out where we lack in infrastructure in this state. And I would like, in a way, I would like to say that all rural areas in Utah were impacted the same way, but they really weren't. The rural areas around reservations were impacted the hardest because they didn't have, when it came to schooling, they didn't have an equal access to digital learning. For many students across in reservation areas, they didn't have internet. They didn't have reliable internet. And not only that, so that was with kids, right? That's what our look here, that's what we focus on. But it affected their parents as well, because a lot of these parents worked in areas where the labor was hands-on. And when they weren't allowed to come to work anymore, they couldn't bring home a paycheck. And then on top of that, they because of their lack of internet, they were unable to apply for jobs that were out there, because almost all applications are online now. Or they couldn't change the style of employment they had. They couldn't receive the training they needed to maybe go into coding or go into website management, or things that could happen online. Or if they wanted to do a job for the state, right? Lieutenant Governor Cox, he had this idea that if I can introduce a couple hundred employees at a time every year into working from home, we'd save the state money and we can do all these things. But what we found out was that people in the rural areas could not take part in that. Today, you have to live in this area to work for state government, really, but with a reliable access to internet, this would allow citizens from all the rural areas, including reservations, to hold state jobs and state positions if they can access the work and material, right? Because now we're finding out that you can work from home, you can be effective from home, but you need the ability to do that. You need the equipment. You need the internet to do it, and that is something that we're figuring out. It says we further recognize that we must listen and learn from each other, realizing that we must understand before we can be understood. It's addressing communication, being willing to sit down from probably a person that you normally would not want to listen to and listen, and them to be able to do the same thing to you. So you have to be proactive in this. It's going to be hard. And so it came down to a couple things. They labeled, I'm very horrible at numbering, apparently it says 1 and 1. But there's five. There's five principles and actions that the state wanted to identify. And the first one is this acknowledgement and action. We acknowledge that racism, a combination of policies and ideas that produces and normalizes racial inequities, exists, and our actions make a difference. We call out racism wherever we see it and take purposeful steps to stop it. That can be hard, right? That can be a very difficult thing to do, because we're not just waiting and then reporting it later. This requires us to be upfront and actionable. I'm going to share something with you. It really isn't It really isn't an example of racism, but it's a part of my life that still hangs with me. I was in a line at a grocery store, and it was late, and so all they had was one register open, and the guy working the cash register, he was checking out a lady in front of me, and something kept going wrong. She kept having to rerun her card, and he kept apologizing. He was really trying to work this out. And then his I don't know if it was his manager or his shift lead comes out and says, "What are you doing?" And he, really pushes him out of the way, pushes a few buttons, and things work out. And the guy, the shift lead or manager, I can't remember who it was, he looks at him and goes, "Man, you got to be smarter than that. You can't be that stupid." And I was in line, right? And I just was like, oh my gosh. And the lady in front of me, she was, I could tell that she was taken back too. And then the guy, the manager just walks off really fast. And the lady says to the guy at the cash register, she was, "Don't let that get to you. I think you're doing a very good job." And I just stood there. I just stood there with like my mouth open and didn't say anything. And that was calling somebody stupid in a cash in a checkout line. And I guarantee you, calling out racism can be difficult. It can be hard. And there's a lot of ways to do it that aren't confrontational, that aren't violent, and they're you can do things in a good way, but you have to practice those, right? You have to prepare yourself for the interaction, prepare yourself for the occasion when these things happen. If this happens to someone else, what would I say? How could I approach this? Think about those things. Practice those things in your head about how you would call out racism, because it's something that we do need to practice. When I teach American government at Utah Valley University, and I ask my students about politics, and they are so scared to share their points of view. They're afraid to say what they believe politically because of them about how somebody might respond. And I let them know that we're going to do this every morning. I'm going to bring up an issue and I'm going to call on people, and you're going to tell me what you think. And we're going to get so used to it that it's going to be easier for you. We've been trained to not talk about politics, not talk about religion, and really not talk about race if we can in public. They're not things that bring good conversation and make people feel good. But we should talk about those things. And the way we can do it without crying or yelling is by practicing. I had a friend that he was telling me that when people would pick on me when I was little, and we'd get in fights, and he was really shaken up when he's telling me about this. And I said, "Did you get beat up?" And he goes, "No, I usually won." I said, "You're shaken, man." And he was like, "Yeah, I don't know why that happens to me." He goes, "In fact, when I was fighting, I was crying at the same time." He goes, "I was swinging hard, tears are going, boogers are popping, because," he goes, "this wasn't something I was prepared for ever." And he goes, "I wonder why boxers and wrestlers, they're not falling apart like that, like I was." And, we talked about it. It's something they prepared to do, something they practiced to do, something that they're ready to do. And it's the same thing when it comes out to calling out racism. Again, there's 100 ways to do it. And we need to find the ones and the ways that work best for us individually, because we need to keep ourselves safe, but we also need to be able to express ourselves and help others in this area. Number 2, investment. It says we invest our time and resources to create greater opportunity for people of color. Eliminating racial and ethnic disparities requires our significant effort and investment. It's not going to happen by itself. That's what this point really brings about. We have to go out of our way in the beginning and this beginning might be a long time. We fought a civil war in 1860 to 65 over slavery, which in itself is racism, and we're still fighting those same feelings today in the workplace and at schools, and so it's not going to happen overnight, but it needs to start happening, and it's going to take some purposeful decision making and purposeful action on our part to make it happen. Public policies and listening. We advance solutions to racial ills by listening and creating equality of opportunity related to education, employment, housing, and healthcare. Right? Look at that. I share with you a lot, and I usually share it on almost every PowerPoint I share with people, and it's Wilma Mankiller's words. And she said that public perception creates public policy, right? She didn't say it just like that. She said it better than I did, but in a nutshell, that's what she said. Public perception creates public policy. How we see each other determines how we treat each other. If we see people as less than us, then we're going to treat them less than us. If we see people as violent, then we're going to pass laws and act in ways that protect us from that violence or subdue them from exercising that violence. If we see people as lazy, we're probably not going to hire them, right? We have to change the way we see people. At the press conference, when the governor was introducing this compact, he brought out a point that I'm really glad he did. He said, he said, sometimes we don't even see people, and we need to start seeing them. I mean, I just spoke about seeing people in all these negative ways that you could see people, but probably the most negative way you could ever see a person is by not seeing them at all. Someone once asked me, how does the U.S. government, or how does government handle um, native protest, indigenous voice? How come we never see that? And that was the strategy I brought up. You know, you can, if you argue with someone, if you listen to someone, if you address someone's concerns, you're bringing more light to their cause. And because there are very few people in this nation that even recognize the existence of Native American people, it's easy for government, it's easy for business, it's easy for corporations to just ignore Native voice, because that is the strongest way to get rid of something. If you address it, if you respond to it, it builds up power. And so we need to make sure that your students, you know, if we're talking about students here, we need to make sure their voices are heard. There was a 2015, Maple Mountain High School, their dance team decided to do a hoop dance routine, native hoop dance routine, as part of their in preparation for their dance competition. A few native kids came out, saw it, and you know, it didn't hit them like, oh, this is horrible, but it made them a little uncomfortable, and so they spoke out against it. And someone contacted my wife and I and said, hey, just wondering, what do you think about this? And my wife was like, they probably shouldn't do that, you know. And then she got a call from someone and said, hey, we're just gonna let this slide. This was another Native person. We're gonna let this go. If this is really bothering the students, we're gonna let the students speak out against it themselves. And my wife was like, well, maybe your students don't know how yet. You know, they're young. They're not used to forming these types of arguments themselves. They're not used to having to defend a position like this. And this is a really strong position and argument that needs to be made. And they'll probably need help. I think if your students are bringing this up, you should probably see what they need, and you might need to speak for them right now until they learn how to do that themselves. And we have to do that. Because if we silence the voice of those that are hurting, that those that feel that they're being taken advantage of or being misrepresented, then those feelings will never be addressed, and we don't know what kind of effect that will have on them. You know, so I you know, as adults in the education field, and if you have responsibility over Native students, we might have to sit back and listen to them and find out what their feelings are about things and how things affect them. And if necessary, we might have to, if they're not strong enough to do that on their own, or if they lack the knowledge or the ability to speak out for themselves, you know, kids, they rely on adults that they can trust. And so we might need to be those people. In your workplace, if you work from others that may not have the tools they need to speak out, you might need to help them, right? And this, I think, relates a lot to our public officials, our elected officials. You know, we need to help them hear the voice of those that are being negatively affected by any legislation, by any laws, by any policies, any practice, right? Any government practice that's going about. And we need to help. And number 4, I think this leads into that. It says we got involved to effect change. People who have an advocate also have an opportunity and feel a greater sense of belonging. More connection will uphold the principle, nothing about us without us. And when I was asked to speak, I work with tribal governments, and I wanted to make sure that I wanted to let tribal governments know that this applies to them. That in government, it's going to be our job to, when we propose legislation, to when we propose policy and different actions, if it affects Indian people, if it's going to affect the lives that they live, then we need to involve Indian people in those decisions. What's that mean for me in my office? Well, we need to be better at identifying government action in its earliest steps, and make sure that our government officials know how this can affect tribal governments and Native communities. How does it affect teachers working with Native students? If there's policies that come about, you need to train yourselves to identify issues that may affect your Native students and say, hey, we're doing this. It looks like it really help Group A and Group B, but our Native students might be affected in a little different way. Can we address that? Can we talk about it? I think about working with tribes, and sometimes our government in the past has said we're going to do this, and just for example, and this really turned out to be nothing at all. But if you voted in the last election, there was an amendment to the Constitution about making hunting a constitutional right, preserving that opportunity to hunt and all traditional practices. Okay, this came about before I took office. And normally our department has someone that reviews all the legislation, and if they feel like it's going to affect tribal governments, they notify our office, and then we send out things to all the tribal governments, say, hey, this legislation is going through the state. You might want to call in and voice your opinions on this during the comment period, or you need to find these legislative sponsors and speak to them and let them know how this is going to affect you. But that didn't happen on this one. And so when the ballot started coming out, so it was already on the ballot. It already passed and went through our legislature. So now we're voting on it. The tribes are calling us and saying, hey, how do we get a hold of the state so we can talk about this amendment, because I don't think we want it. And I was like, well, at this point, you're going to just have to vote no against it then, because it's already gone through the process. And they were very upset. We weren't even notified. Someone should have contacted us. And so I jumped online. I looked it up what session it went through, and when the comment periods were, and I let them know that, and I told them that we'd be better in the future. But they were still very upset. They thought that this amendment was somehow going to affect their treaty hunting rights between them and the federal government. And I explained to them that any hunting rights through treaty are guaranteed through the federal government, not through the state. Nothing the state can do can bypass that relationship and that agreement between the state and the federal government. But still, it caught them off guard, and we should have been there for them, and we should have done more to get in front of that. Because what if it did affect their treaty rights? And I wouldn't be able to say that we're helping tribes maintain and uphold the principle of nothing about us without us, right? Stifling Native voice, stifling their opportunity to speak out. And I think about, students. If it's going to affect Native students, I hope you help them feel a greater sense of belonging. I hope you help them feel, like it says, and to have opportunities, right, to where their voice can be heard, because kids with an advocate can do a lot, and they can learn a lot. The last principle on this compact was a movement, not a moment, right? Utahns unify behind a common goal. We affirm our commitment will not just be a passing moment, but a legacy movement of racial justice. We are all in. Right? Let's not, the state was concerned that, well, we're going to be really psyched up for about 2 weeks with this compact, but we need to keep this in our eyes. We need to keep this in our minds. We need to keep this visible to everyone so that this becomes a movement that lasts a long time. And this is one of those things that has to continually be stressed, because it's easy to fall back to older ways of thinking, that where we see people as less than, right? And it's going to be hard. I want to stress that this just isn't a Utah government goal. This entire compact is being signed by the governor. And really, it's holding all of the citizens of Utah to the standard. In our personal, in our professional, and in our political lives, we're going to need to do better and being more proactive in stomping out racism. So that's what this is saying. That's what this compact does. And I hope that we can do that. In closing, I wanted to look at something that I'm sure you've all heard about. New Mexico House Representative Deborah Holland from the Laguna Pueblo has just been nominated by President-elect Joe Biden to serve as the Secretary of Interior for the Department of Interior. No Native person has ever been able to serve in that position before. Now, within the Department of Interior, the Bureau of Indian Affairs is, and the assistant secretaries there, many of them have been Native American people, well-qualified Native people, to run that bureau. But to be a Native person running the entire Department of Interior has never been done. And so her nomination is exciting. She still needs to get confirmed by the Senate. I was asked last night, a news channel called me and asked me why people should be excited about this, or how this affects Native people, how it's going to affect our relationship with the state and the federal government. And so she asked me, "Are you okay with this appointment?" I said, "Yeah, I'm okay with it." I think she's qualified to do it. And she, well, how do you think tribes will respond, or what does this mean for tribes? And I listed these things for her. I said, well, Deborah Holland's law trained. She went to law school. She understands federal Indian law and policies, but she also knows how to make argument. Right? She knows how to stand up and provide evidence for things. But she knows how law and policies affect people. And because of her law training, she's going to be good at spotting issues. When she sits down with her group from the BLM, from BIA, from Indian education, from all these things, when she sits down with her group of people, she's going to be able to spot issues that affect Native people, because this has been her job and her passion for so long. She's Native American, right? And just being Native American doesn't make her the ideal choice for this position. What makes her so ideal for this position is that she's lived the policies of the Department of Interior, right? She's lived. She, like most of us, if you're a native person, you've lived those policies, you've lived those laws, and you've been affected by them. So her voice will offer that perspective that hasn't been there before. You know, she can say, this probably isn't a good idea because it affects Native people like this. How do you know? Because it affected me like that too. And I was living in this circumstance or that circumstance, and I know how we can do better. And so I'm excited for that. I'm excited as a father of two Native girls, two young girls, that they can, when Deb Haaland and Sharice Davids got elected to Congress, my girls were excited. And when this happens, they're even more excited. And they can see this example before them, that ceiling is rising, and maybe that America may be ready for this. But for America to be ready for this, we're going to have to open our minds a little bit and relieve ourselves from maybe some past biases and prejudices that we hold. And so I was very happy that Governor Herbert is supportive of this compact. I'm so happy that he signed on to it. I'm happy that Governor-elect Cox has signed on to it. But that's step one. After this, it's us. It's us working in government, working for the state. Us that have responsibilities over Native people, in your case, Native students, to make sure that everyone's treated fairly. And I hope that we can all prepare ourselves for this. I hope that we can practice how we're going to carry this out, so that things will be good for the people we represent. And with that, I'll stop and I'll open it up for questions.
Hey, Dustin, thank you for that overview of that compact, plus an update on the Department of Interior's selection with the Biden-Harris administration. I think that's a very, very good place to be right now. You know, when you mentioned a little bit about the compact and some of the information that is disseminated out there, you know, I always lean toward education, because for me, education has always been my lifeline. You know, I don't know anything else but education. You know, as a classroom teacher, as a school administrator, and now as the serving as a State Department employee, I think that when we do talk about there has to be a change, I think that the restructure of the whole curriculum system has to change, because it kind of reminds me of that Gitzel-Gubel model. Whatever you put into the system is going to kick out. If we put in good information, provide that information for those kids who are in kindergarten to third grade, get them to see that foundation, build a foundation of a base for those kids who are in 4th to 6th grade, 7th to 9th grade, and then you get into high school. For me, the changing of that structure has to change where it meets the rationale of this racial concept, or the compact. Because all this falls, for me, this all falls into civic education through curriculum development. Now, if I feel that if nothing changes, things are going to continue to be on the same track. You mentioned something about the character also. I think there are a few tribes out there I know that the Navajo in particular, they have this segment on character education. and how to be a citizen, how to be a person in the community. So I think that also has to be built in terms of that character building. A piece to that is the social education. Some of these are not built into the regular curriculum, but I think there's room for that. And I think that if we, or well, whoever, is in the position where they can start to change things, to restructure the whole educational curriculum system, these are places I feel that they can fit. So when we raise a generation of students, when they come into kindergarten, first, second, third grade, they're learning a little bit about the base. When they become juniors and seniors, when they graduate, they have that foundation built. And I know that sometimes this foundation, it crumbles. We take things and the concepts in the wrong direction. So we have to be a little bit careful of that. So I think that my time and investment in education, that's basically that's how I feel in terms of how this whole curriculum restructuring should at least they take a look at that piece there. So anyway, that's my rationale, and that's my input.
I think you're absolutely right. And we're looking at education here, and that structural foundation that currently exists is going to have to be changed uh, to get good input, to get the output that we desire. And I think that's going to happen. It needs to happen through all levels of government and society.
Yeah.
In whatever field, we have to start changing our foundations a little bit, and making those changes for a better future. And I hate to do this, Chuck, but maybe we could continue this conversation another time. But I have to drive.
Well, yeah.
But you guys, please continue the conversation. Save up questions. Please email me, or if you want to address them, if we come back and meet together again, I'd be able to do that. But I just want to thank you all for the work that you're doing, serving the students of Utah. I want to thank, I don't know if Melissa Zito is still here, but I encourage all of you in serving in Native communities to continue using her office. If you feel like your kids need something PPE, contact Anna Boynton in emergency management. She's a tribal liaison there, and they've been both really good at working with tribes and making things happen. So with that, I wish you all happy holidays, Merry Christmas, and I hope this next year is a lot better than what this one ended up being. We'll see you all.
There's a hand raised for Eileen. Do you have your hand raised?
Yes, I wanted to make sure that I address this, Dustin. I know that you referred to that experience that we had with our district. Behind the scenes, we did go into action as an Indian Ed program. We met with administrators, we met with counselors, we met with teachers, we met with the athletic teams, and it was very, very hard. The area that we are in is very, very conservative, and did not want to budge in many of the audiences that we had and we had a lot of people. We had a 65-hour week that first week, and it followed the second week into it. And so behind the scenes, there were addresses that were made, and it was very tough, very hard, but we were able to go through that. But we do need to change our support system within the school districts, because as a small Indian Ed program, sometimes you're feeling, unless you have the audience of your and the support of your administrators, then you can really go into it and really do some work. But at that time, it was very hard.
Yeah,
and
Yeah, I was gonna say, without your voice, without that adult work that went on, it would have been very hard for these students to voice their opinions on this, and we need to do that. And so I'm very glad you brought that up. I'm going to step out now, but thank you all so much for this opportunity, and I'll see you all in the future.
Hey, thank you, Dustin. Thank you
Thank
very
you.
much.
Thank you.
Yeah, well, let's get on into our last piece of information, and this is going to be just a small information provided by Renee, and this is the electronic signatures. I know that some are pursuing that, and there's different ways that it could be done, and so on and so forth. So, Renee, go ahead and you can go ahead and start.
Okay. I'm trying to find to share my. I know where to share it. I'm just making sure I'm doing it right. It is not showing up here. Desktop, yes. Let me see why it's not showing up. Okay, can you see that? Hello?
Yes, yes, we can see it.
Okay.
We can't hear you very well.
I'll try and scoot up. Does that help?
Yes, that helps.
Okay. This is just a generic invoice you would fill out. These are what I do, like for Dustin to come and talk with us. Dustin and I have a lot of experience with this. And unfortunately, we have to let you know that there are bugs. There are bugs when you're sending it through email. For some reason, the boxes do not always work. I wish I had better answers for you on why they don't work. Don't know. But this is a nice way to get things signed. Okay, this is a Word document here. First thing you need to do is turn it into a PDF. Okay, so we'll just load this to my desktop. Now, you all know how to do that, turn it to a PDF. I hope that's a yes.
Yes, I think that's a yes.
Yes. Okay, well, let's go over here to the right-hand side. You now have this PDF. You're going to pull up, let me move this little guy. You're going to pull up prepare forms.
We can't hear you again.
I'm not sure why. Is that better?
Yes.
Weird. Okay, so you hit prepared forms. This is what'll come up. And you start. Okay, now that you've started, you can fill out whatever you need. It's already set up. Most forms, at least this one is set up for you to type into. But you need to get a signature over here. So this little box right here, it should come up and say signature. There we go. Add a digital signature. Add signature options from the properties view. So just click on that. This little box will come down. Now, these are already set up, but my boss always has to have one added for her. So you just pull it over and hit enter, and it just stops right there. Now, if this was my form, whoever you're sending it to is just going to double click on there. Oh, I've got to save it first. I'm sorry, I'm not good at these presentations. I don't talk usually. I sit back and listen. Okay, so now see the little red arrow? It's set up and ready to go. So your person now just double clicks it. That comes up on mine, telling you that it's me that's signing it. Hit continue and sign. Now it's going to make us save it again. And there I am. It's really just a simple little process. And it's very convenient in this time of everything going through the internet.
Yeah.
It's just a nice little convenience. We are getting some new platforms for this that will work better so that the boxes don't for some reason stop working. I'll be honest, I'll give you a 50-50 chance when you send it through email that the box will work. But as we get better technology, I'll come back on here and show you guys the better technology so it'll work. Any questions?
Well,
Okay.
thanks, Renee. You know, I think this form, you know, this is just an example that she has for you. I know that we have certain forms that like with the tribal consultation confirmation has to be signed, as well as your ESA form that needs to be signed, and any presenters or presenters that come about with your programs, they all have to be signed. You know, this is just only one example. And if you set it up a certain way, because I think the key to this whole thing is turning this into a PDF. Because you know, I had an opportunity to go through this training with Renee, and you know, it was the first 2 or 3 times it was a hit and miss. But now we become a little bit more of an expert, right, Renee? So
We're getting there.
yeah, so that's
temperamental, but it's amazing in this day where we're not seeing each other in person.
Yeah.
It is very convenient to know how to do.
Yeah. Yeah. So again, thank you, Renee. And if there are any other questions, I guess they can email you, or they can talk
or
to you.
If
And so
you
and
just
so.
need help.
Yeah,
if you need help doing one, and it, you know, send it over. I'll be happy to help with it.
Okay. All right. Thanks. And the last piece is just basically some updates. You know, this is the end. This is coming to an end with our Title VI first semester program. You know, we have vacation within the next few days that starts, and they'll go through Christmas as well as New Year's. And I just like to thank everybody for their services rendered and everything that you put forward. You know, it was a really, really tough year, starting last year in March. It went right through summertime, and it started at the beginning of this year. And, you know, we all struggled, and nobody, you know, that I hear of that it was easy. It wasn't easy for anybody. It wasn't easy for you. It wasn't easy for me or those people that we work with. And a lot of it that we serve our students and our families. You know, they were looking for that support, and you guys were there as a support mechanism for them. And I think they're very grateful for that. I know this coming semester, you know, we're going to have to regroup, and we're still not out of the woods yet. You know, there's a little peak at the end of the tunnel, but still that tunnel still it's still a long way to go. And we just got to hunker down and regroup, get rested, eat healthy, stay healthy. And there's always someone out there to listen to your concerns. You know, sometimes it's pretty tough. You know, I really, you know, just one experience I've had was with my daughter and my granddaughter. Both had COVID-19, and both of them really didn't show a lot of symptoms, but I could see it in their eyes, in their heart. They really struggled. It was a time where we all came together, through prayers, and I use my traditional ways of doing things, and now they overcame that. Now we're back on the healthy side. So I know that there are people out there struggling, just as I suggested. I have people that I keep in contact from the Denali Reservation, and they too are going through basically some of the same challenges, and some even more. So I thank the Creator for my health and the wellness that has been provided for me. So, and I wish you all a good holiday, a safe holiday, and that just stay safe. I like to. Is Lucy on? Lucy, if you're on, I'd just like you to say a few words. I know that you're going to be retiring at the end of this month. Thank you for the service that you've rendered for us and for the students in the community and the schools that you represented and the school district that you come from. I really appreciate what you've done in the past. And I'd like you to thank you for your service. And if you could say a few words, I appreciate that.
Well, thank you so much. I appreciate. I'm going to miss all of you, and I have appreciate being a part of the Title VI program. I have met a lot of people, and I can't even try to thank what you do and for our students and for our families. And thank you, Dr. Foster, and everyone. I will continue to advocate, and I'm going to try to come back and get on the board at our school district here. They need to be a little bit more diverse, and I'd like to be a voice for our families in my community. And thank you so much, and have a happy holiday. Enjoy your families. They're so precious, every single one. And thank you so much, and God bless.
Thank you, Lucy.
Thanks,
We're
Lucy.
gonna miss you. And now, are there's anybody out there that would like to say anything, departing words before our Christmas vacation begins?
Yate, I'm Brenda Whitehorse from San Juan School District. And I just wanted to share that we have our Heritage Language Conference, virtual conference on our website. And everybody's welcome to go into our school district website and access our conference. We had some great presenters. We had Pete Sands was our keynote speaker. And then we were able to get Bahi Whitethorn and some other wonderful presenters. So I hope that you're able to access it on our San Juan School District website. And then we also have a Facebook page, San Juan School District Heritage Language. And this month we shared a coyote story from our Heritage Language Resource Center. So I hope you can access those, and let me know if you need help accessing that information. Thank you.
Thanks, Brenda. I have a note from Penelope. You have updates from the Urban Indian Center?
Hi, everyone. I do have updates. So we do have our community needs assessment survey on our website. And so if you are a resident within the Wasatch Front, you can go onto the website, which is uicsl.org, and participants can receive a $25 gift card, those who are adults. And then if you have youth who are over the age of 10 to 17, they also have a youth survey, which participants can receive $10 gift cards. So take a look at that website. It's great information that will help our center with services and our programs. I'll be sending Dr. Foster the attachments for our new Native Reach app. And so we do have upcoming new programs for diabetes prevention, blood pressure prevention, and a healthy lifestyle program, which participants can receive a Fitbit if they participate in the program for 6 months. So I'll send that all to Dr. Foster, and great opportunities, especially with our time in with the pandemic. We got to keep moving and we got to stay healthy. But Happy New Year and happy holidays from the Urban Indian Center.
Hey, thanks, Penelope.
I've included the links to the Heritage Language Conference site in their chat, and then also to the San Juan School District Heritage Language Facebook page.
Okay. Thank you, Brenda. Is there anybody else who would like to share? If not, again, I'd like to thank everybody for your services. You know, the care that you have for your program, the care that you have for your students and your families. You know, we just got to move forward. And this coming vacation time would be a good time to get yourself well rested, you know, stay safe and stay healthy. You know, just follow the lead in terms of what that COVID-19 to administer to keep that out of our homes. You know, it's I know that's a very, very it's a deadly disease, and I just I'm glad that we do have vaccinations coming down the pike. So with that note, I'd like to thank you guys again. Merry Christmas and a Happy New Year, and we'll see you in January. Hey, thanks again.